just let me just throw this back up there. All this should be labeled, okay? When we're talking about the portal venous system here. Keep in mind this big structure right here, that's the inferior vena cava, and we also have our two hepatic veins that drain directly into the inferior vena cava. All right? Simple rule. If it's blue, it's a vein, all right, for the most part, all right, unless we're dealing with the heart, different story. All right, if it's blue, it's a vein. If it's red, it's an artery. If it's purple, it's a portal vein. It's a mixing of blood. That's what portal veins will see, okay? So you see these red vascular structures here, all right, those are going to be your hepatic arteries. This one here. Yeah, this, well, I mean, it's kind of purple. I mean, yeah, I know. It's not the best, but yeah. And then here, all right, you can see these structures here and here, all right, those are going to be your hepatic portal veins. All right, then that's where you're going to get a mixing of blood in the sinusoids, and we'll talk more about that, just not in lab. All right, I do believe I did cover this slide here, but just a quick review. All right, we're now in the abdomen here. And we're talking about the abdominal organs. Those are also the retroperitoneal organs, which are going to be the kidneys and the adrenal glands. And so we have blood vessels that are going to supply some of those structures. All right. The middle suprarenal. Suprarenal is another name for the adrenal gland, by the way. Okay. So the middle suprarenal artery is going to supply the adrenal gland. All right, the renal artery, obviously, I don't need to tell you what that's going to supply, the kidney. And then the gonadal artery is going to supply either the testicles or the ovaries, okay, the gonads there, okay? And the nice thing is that all of these arteries come off of the descending abdominal aorta, all right? And then they will all be drained. All of these structures, okay, the adrenal glands, the kidneys, and the gonads are going to be drained by the arteries of the same name. So it's easy. You know, if you know the artery that's going to be supplying the structure, then you're going to know the name of the vein that drains it. Okay? But when we're dealing with the arteries, all of the vessels come off of the descending abdominal aorta, all right, when we're discussing the adrenal glands, the kidneys, and the gonads there. All right. I already went over this one too. When we talk about the descending abdominal aorta, it splits off into the right and left common iliacs, and then the common iliacs will then split off into the right internal and right external iliac, and same for the left, okay? So the internal iliac has, all right, these branches here. I'm not going to go through them again, but keep in mind that they're going to supply the internal structures of the pelvic region and some of the posterior structures on the pelvis, like your gluteal muscles, for example. Okay? So the superior and inferior gluteal arteries are going to supply, all right, your rear end muscles. Okay? For example, so go through these, just kind of review that. All right, you can see here, okay, just a quick review of some of the arteries that come off of the descending abdominal aorta. That first branch, that's the celiac trunk. And the celiac trunk, again, it's very small, but then it gives off three branches: the left gastric, the splenic artery, and then the common hepatic artery. All right, then if we go a little bit more inferior, we get to the superior mesenteric artery. This is going to supply a significant portion of your digestive system. All right, and then we keep going down, then we have our inferior mesenteric artery. And then another unpaired artery is going to be the median sacral artery. And that's at the bifurcation of the left and right common iliacs. Okay, so that's going to sit right there on top of the sacrum. All right, and then when we're talking about our paired arteries, all right, this is kind of what I was talking to you about. The middle suprarenal artery, our renal arteries, and our gonadal arteries, those all come off here, off of the descending abdominal aorta. Then we have our common iliacs, and then we'll have an internal iliac, and then we'll have an external iliac. Now the external iliac, when it hits this structure here, you need to know this is the inguinal ligament. Okay, the inguinal ligament. And if you remember last semester, when we were talking about, remember psoas major and iliacus, those two individual muscles here in the pelvis, then they fused together, and when it emerged below the inguinal ligament, all right, it was known as iliopsoas, which is the strongest hip flexor, all right, of your hip there. All right, so we use the inguinal ligament to also change the name, because when the external iliac artery emerges from or underneath or is inferior to the inguinal ligament, it is then known as the femoral artery. Okay, so it's just an important anatomical landmark here that we like to use. Okay. Wait, did I skip one? Okay. So let's get into the lower limb, and then we'll label the upper limb here. Okay. Okay. So for our lower limb, the external iliac artery is the main supply because, like I just said, it becomes the femoral artery as it emerges or is inferior of the inguinal ligament there. And at one point, it gives off this nice branch called the deep femoral artery, and that's going to head back towards your hip joint there and several of your thigh muscles. Think of the femoral artery as just passing through. It's just going to pass through the thigh, okay? Because when it gets down to the knee, the femoral artery then splits. All right, well, it doesn't split yet, but when it gets down to the knee, it changes name again. And it's known as the popliteal or popliteal artery. Okay? Yeah, the back part of your knee is called the popliteal or popliteal fossa. So when the femoral artery gets to the behind the knee, all right, then we change its name again to the popliteal or popliteal artery here. And then that artery, and it varies, but it will split into the anterior and posterior tibial arteries. So obviously the anterior tibial artery is going to go towards the front of your leg. The posterior tibial artery is going to go back towards the back of your leg. All right, I'll show you a labeling here, but let's break down the arteries here just a little bit more. Okay, so now we have an anterior tibial artery that's going to supply, all right, the anterior portion of your leg. And as we get past the ankle, it becomes the dorsalis pedis artery. And actually, that's a good artery if you're checking peripheral pulses on people. All right, if you can't get a really good palpable pulse, like a femoral pulse is a good one, but you just can't quite get it unless people have fat ankles. All right, but the dorsalis pedis artery, just have them laying prone on their or supine on their back, you can palpate that artery out real easily. And it's a good way to check if they have a strong peripheral pulse, especially down in their lower extremities. If you're getting a weak dorsalis pedis pulse, that can tell you some things. You know, there could be some pathological issues going on there, weak pulse in there, maybe there's a blockage or something, okay? All right, so as soon as the anterior tibial artery crosses the ankle, we refer to it as the dorsalis pedis artery. Now, our posterior tibial artery, again, is going to supply the back of the calf, the leg, okay? And it gives off the fibular artery, and that's going to be the lateral portion of your leg. Think of the fibular bone, the fibula. Okay, that's the lateral. It's on the lateral portion of your leg. So the fibular artery will also be there. Okay, staying with the posterior tibial artery, it's going to then head down towards your foot. The plantar side of your foot is the bottom portion of your foot. Okay, and so it then branches off into the medial and lateral plantar arteries. And they create this arch. So these two arteries create this arch in which it gives off these small branches here out to the toes. And those are your digital arteries. Okay? So depending if this is the big toe here, okay, then that's going to be this artery is going to be the medial plantar artery. And if this is your little toe, your pinky toe here, then this will be the lateral plantar artery. All right, if you got your atlas out, let's label a couple things on here. These are not the easiest. I tried to clean them up as much as I could. Keep in mind the colors, all right? The colors here, all right, with the colors for these numbers here. For example, all right, some of these, like 27 and 14A, are supposed to be pointing to both the artery and the vein. Okay, even though it's pointing to the artery here, Okay, this is going to be the right common iliac artery, and then the vein that's accompanying it is going to be the right common iliac vein. All right, and then it branches. So over here, 27A and 13 is pointing to the left internal iliac artery and vein. Then where it kind of continues here, all right, you can see 27B and 14 is going to be the right external iliac artery and vein. And then it's going to, you can't really see it, all right, but the iliac, the inguinal ligament pretty much goes right here, all right? So when it emerges out, like you can see here for 33, all right, we're down pretty far, so we're into the thigh. You can tell you're nicely down in the thigh here. So 33 and 32 is going to be the femoral, or specifically the right femoral artery and the right femoral vein. Now going over to this side here, you can see you don't have to, it's not labeled on here, but you can see this branch is coming off. That's the deep femoral artery. You don't have to know that I'm just showing because we talked about it. All right, so this artery is going to supply all these structures in the thigh. The femoral artery just kind of passes through, all right, and it dips down towards the knee. Once it gets to the knee, okay, here's the knee joint. Then we refer to it as the popliteal or popliteal artery. It's in the back there. Okay, and then it's going to divide, all right, into the anterior, all right, tibial artery, and then the posterior tibial artery. Okay, this vein right here, you see this big vein here on the medial surface of the leg. All right, we call that the great saphenous vein. Does anybody know the clinical significance of the great saphenous vein? This is the vein that they use when they're doing a CABG or a coronary bypass surgery. They take that vein out of the leg, okay? And believe it or not, a lot of people will complain more about that incision or the pain in their leg than they will in the heart after the surgery. But it's amazing because when they take this vein, they have to turn it inside out. Does anyone know why? When you do, exactly, that's always, I knew exactly what you, because of the valves. Remember, veins have valves, arteries do not. So if you're going to do a bypass, and usually it's on coronary circulation, we've got to replace, all right, those arteries with a non-valvular structure. Well, they're not going to go in there and clip out the valves, just turn it inside out. Here's the crazy part, and I have to tell you guys this because it's fascinating to me. That over years, that blood vessel, that bypass blood vessel, remodels itself into an artery. Cool. It's just so cool. So it changes, it converts itself from a vein into an artery. Awesome stuff. Okay. Here we go on to the lower portion here. All right, and you can see here is the continuation of the great saphenous vein. All right, it's on the medial portion on the inside of the thigh and the inside of the leg here. Okay. And then you can see here, number 36, here's the anterior tibial artery. It's running down the shin here on the front. All right, and then as soon as we get past, here's the ankle joint. As soon as we get past the ankle joint, then it's known as the dorsalis pedis artery. You can see it here on the right side, and then you can see it here on the left side. Now, folks, you have to be specific on this, all right, on the test. Anatomical left, anatomical right, okay? So please keep that in mind, and I think we can figure out which is the left leg and which is the right leg, but just keep that in mind. All right, so dorsalis pedis artery right over here, and then you can see we've got this, I want to make sure I got the colors right. So 38 here is pointing to this red arch. Okay, so that's the plantar arterial arch, and it gives off, all right, these digital arteries that go out to the toes. Okay, so if it's red, it's an artery. Okay, then you can see this blue arch here. Okay, and the blue arch is going to be the plantar venous arch. And then it also gives off its veins. And those are going to be the digital veins. Okay? So on this side here, you can see a really nice example. Here is the fibular artery coming off of our blood vessel here, and then back on the back side here, 35. All right, that's the posterior tibial. Okay, passes down here, and you can kind of see on the front side here, all right, the anterior tibial kind of ducks away for a moment. And then once we get past that ankle joint, then it's referred to as the dorsalis pedis artery. Okay. All right, I already seen that. All right, so let's do the veins here real quick, and then we'll wrap up with the upper extremity stuff. Okay, so of course, if we're going to deal with the veins, we're going to go in the opposite direction. We're going to work up towards the pelvis. Remember, veins are going to drain into things. So we'll start off with the dorsal venous arch. All right, the dorsal venous arch. We saw the plantar arch there. Now we're going to see the dorsal venous arch. It's going to have its digital veins, all right, that are going to merge with it. And then again, all right, when we're dealing in this situation with the dorsal venous arch, now we're not dealing with medial and lateral plantar veins. We are now dealing with the great saphenous and the small saphenous. Okay, so the great saphenous is going to be medial, small saphenous is going to be lateral. Okay, so the dorsal venous arch is going to drain into both the great and small saphenous veins, depending if we're dealing with the medial, say this is the medial side, which would be the great saphenous, and this is the lateral side here. Okay, so the great saphenous vein is going to drain into the femoral vein. All right, and it's going to be pretty much the whole medial way of that lower extremity. It sits right there. Then the small saphenous vein is going to drain into the popliteal vein or the popliteal vein. All right, last part here for the lower limb. Okay, so you can see on this situation too, all right, when we're talking about, that's for the superficial veins. All right, now we're going to go deeper into our limb here, okay? And we have our medial and lateral plantar veins, all right, which are going to drain the digital veins of the foot. And then those medial and lateral plantar veins are going to drain directly into the posterior tibial vein. And also the fibular veins too. So from there, the posterior tibial and the anterior tibial will come together, all right, and merge and form the popliteal vein. And then that popliteal vein, again, as we head up the thigh, once we get into the thigh, past the knee, we rename it and call it the femoral vein. And then that femoral vein is going to duck under the inguinal ligament. When it does, we rename it the external iliac vein. All right, it's kind of what we saw with the artery. How the artery, all right, when it passed underneath the inguinal ligament, we renamed it the femoral artery. Well, same thing here when we're talking about what happens to the femoral vein and the external iliac vein. Then the external iliac vein will meet up with the internal iliac vein and form your common iliac vein. And then your two common iliacs fuse together and form the inferior vena cava. So let me go, I'll show you on this real quick. It can be confusing. All right, so we're going backwards now. All right, let me just do the veins first, just so. All right, so here's your popliteal vein. We're right behind the knee, okay? So once we get into the thigh, we just rename the popliteal vein the femoral vein. And it'll run up, okay, the thigh. Here's our inguinal ligament here. Once it ducks under the inguinal ligament, all right, on the other side, it's then known as the external iliac vein. And when the external iliac vein fuses, or joins, I should say, with the internal, then we have our common iliac vein. And then our right and left common iliac veins join together to form the inferior vena cava. So if you look here, you can see here's the great saphenous vein, right on the medial portion of your thigh and leg. great saphenous, runs that entire length down here. All right. Then you have your dorsal venous arch. Okay. The dorsal venous arch is going to drain into the small saphenous and the great saphenous. And then you can see here are our digital veins with the medial plantar veins. Right, you see a whole bunch of them. Okay, and then they're going to join and drain into the posterior tibial veins. So here is the posterior tibial. And then we've got our anterior tibial, and they'll come together. And when they come together up here, all right, then we're going to have our popliteal vein. All right, let's finish up with some labeling here. This is a long chapter, y'all, I understand. Okay, but this part's a little bit of review, okay? So for here, we're going to start with the heart and work our way out, okay? Not the best picture, we can't really see too well, but this is the ascending aorta, okay? So the ascending aorta gives off 3 branches, okay? So the first branch that you can see here, all right, that's the brachiocephalic trunk. Remember, the brachiocephalic trunk is going to split off into, all right, your common carotid, all right, or I should be your right common carotid, and then it's going to split off into the right subclavian. All right, so your subclavian, this branch here, this branch that the arrow is pointing at, that's going to be your right vertebral artery. And the right vertebral artery is going to then travel up through the transverse foramen of the cervical vertebrae there. Okay, you have a right and a left vertebral artery that supplies 20% of the blood supply to the brain. All right, as we move along the subclavian here, okay, we get towards the armpit, we're going to have a name change. Okay, how do I know it's the armpit? Well, here's the humerus, the head of the humerus, in the glenoid fossa. All right, so we're in the axillary region here. Okay, so that's going to be the right axillary artery. Then we start to continue on into the arm. What's another name for the arm? The brachium. Okay, so now we'll name this artery the right brachial artery. Okay, so again, it's the same blood vessel. We just change its name depending on where we are. All right, so it continues on down, and it'll split here in the elbow, right? Also known as the cubital fossa. All right, and now mind you, in the anatomical position, your thumb is on the outside; it's lateral. Okay, you have 2 bones in your forearm, the radius and the ulna. The radius is on your thumb side; the ulna is on the pinky side. Okay, so if your thumb is out, that means your radius is going to be lateral. So if we follow this down, all right, this blood vessel that's going to be lateral, that's going to be the radial artery. Makes sense, right? Because we have the radial bone there. Okay, because remember, anterior, the anatomical position, palms forward. Okay, thumbs are facing out. Okay, then this artery that's on the inside, that's going to run down on the inside of your forearm. All right, that's going to be the ulnar artery. All right, I'll show you on the lower, not the lower extremity, but the lower model here of the forearm here. All right, let's do the venous drainage here real quick. Okay. So what I'm seeing, I'm going to start with the heart again. So this blood vessel that drains the upper extremity, the upper part of your body is called, that's the superior vena cava. And the superior vena cava forms, all right, when your right and left brachiocephalic vein join together. All right, so if we're staying on the right brachiocephalic vein, okay, you have your internal jugular vein, your right internal jugular vein, and your right subclavian vein come together and join to form the right brachiocephalic vein. So if we follow the right subclavian vein towards your armpit, it gives off this branch right here. All right, and that's the cephalic vein. That's the vein that you see in those bodybuilders and whatnot, popping out in the arm. All right, that's the cephalic vein. We also follow the vein down. We get to the armpit. Guess what? We change names. Okay? We did it for the artery. We're going to do it for the vein. We're going to call that the axillary vein. We continue on. We get into the arm. Now we're going to call it the brachial vein. So we cut the brachial vein here, all right, and you can see we have this other vein that is on the inside of your arm, all right. That is the basilic vein. All right, I always just think of this portion, the medial portion of your arm, is the base, so that's how I remembered it as the basilic vein. All right. Then you can see coming off the basilic vein, this one vein that crosses over here, all right, and it crosses over the cubital fossa. Okay, and so we name that vein the medial cubital vein. Crosses right over. So then we have the basilic vein here on the medial portion of the arm, and the cephalic vein here on the lateral portion of the arm. All right, and then just to finish it off, all right, you can see here's the continuation of the basilic vein running on the inside. All right, here's the cephalic vein on the outside here. All right, and then we have our brachial artery splitting off into the right radial artery and into the right ulna artery here. But when we get down here to the palm, you can see, all right, we have another arch here. So again, if it is a red arch, we call that the palmar arterial arch. That's 31. If it's blue, all right, we are going to call that the palmar venous arch. And then similar to what we saw on the foot, it's going to give off digital arteries here. Okay, so we'll call the either digital arteries or digital veins depending on the color. Okay. So color is going to be important, and usually on the test, if you're concerned about what it's going to ask you on the test in regards to, it'll say red or blue in reference to the color of the blood vessel. So you should be pretty covered on that. I wouldn't worry about that, okay? It'll be really, really obvious. Okay, questions? That was a long one. That was a long lap. You guys did awesome. Oh, I didn't even see that question. Yes, Alexa. Oh, I'm awful. I will be sending out a Quizlet. You guys got the Quizlet for the arteries and the veins. You're just missing the lymphatic one. So that's the last one I believe I have to send out to you. Yep, I'll be sending that out on Wednesday. Okay, every Wednesday if there's a Quizlet available. All right, let's talk a little bit about the lymphatic system. I want to get started on that just a little bit here. So I am going to